your central nervous system goes under attack. And then by the second or third week, I was walking with a cane because my whole right side was paralyzed. You just feel like it's not your body anymore and you're not in control.
Why are serious cases of rat lungworm occurring at an increasingly higher rate? Is it inevitable the disease will spread to all islands? Can you drastically reduce your risk of getting it? Our state's leading experts are in the studio waiting to answer your questions about rat lungworm disease. This live broadcast and live stream of Insights on PBS Hawai'i start now.
Aloha and welcome to Insights on PBS Hawai'i. I'm Laura Yamada. Officials say that rat lungworm disease has been endemic to Hawaii for 50 years, averaging around 9 cases a year. As of today, 15 cases have been confirmed so far this year alone. That's an increase of 4 cases of rat lungworm disease over last year's total. Doctors and public health officials have said there have likely been more infections, but the symptoms were mild and such cases could be diagnosed as possibly the flu or intestinal virus. Some experts worried that indicators suggest not only will more people become infected, but the trend seems to show an increase in severe cases that can leave a victim with permanent nerve damage. So what is rat lungworm disease? How is it spread? What precautions can you take to lower your risk of getting this disease that causes a form of meningitis? We're taking your questions tonight, and some of the state's leading experts on rat lungworm disease and a woman still recovering from the illness are joining us tonight. We look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll also find a live stream of this program at pbshawaii.org and our PBS Hawaii Facebook page. All right, now to our guests. Dr. Virginia Pressler is Director of Health for the State of Hawaii Department of Health. She is the former Executive Vice President and Chief Strategic Officer for Hawaii Pacific Health. Dr. Pressler also served as Vice President at the Queen's Health Systems and was the Associate Professor of Surgery at the John A. Burns School of Medicine and was in private practice in general surgery. Dr. Susan Jarvie is Chair and Professor of the Department of Pharmaceutical Sciences at the Daniel K. Inouye College of Pharmacy, University of Hawaii Hilo. Dr. Jarvie has researched rat lungworm disease for the past 5 years and has been recognized as the foremost expert on the disease in the United States. Dr. John Martell is an internist practicing in the Hilo area, including Hilo Medical Center, where 12 severe cases of rat lungworm were treated in just the past 6 months. Dr. Martell received his medical degree from Duke University School of Medicine and has been in practice for more than 20 years. And Laura Travis contracted rat lungworm disease more than a year ago while living in the Puna district of Hawaii Island. She is currently in recovery. Ms. Travis is a registered nurse and a certified childbirth educator. She's also a longtime Navy wife and a mother. She and her family currently live on the mainland. Ms. Travis was also inspired to be part of tonight's discussion, and so she paid her own transportation and expenses in order to be with us tonight. So thank you so much, all of you, for being here. We greatly appreciate all of your expertise and your time. Now you're going to notice on the screen we have a crawl at different intervals, giving you some tips on the main categories for prevention for rat lungworm disease. Those include food and water, home and garden, and management of pest control. So we have quite a few questions to get through, but we're going to go ahead and just kind of initially set this up and get everybody familiar with what rat lungworm disease is all about. There are people in certain areas, Puna for example, that are more familiar with it, but other people in the state not as much. So we're going to try and break it down and give everybody as much information as possible. So let's start with you, Dr. Pressler. Let's just set it up, the framework for this. What exactly is rat lungworm disease?
It's a parasite, and it requires both a rat and a slug or snail cycle. And the way that a human gets infected is by ingesting a uncooked or undercooked snail or slug, or it could be a freshwater shrimp or crawfish that has that's infected with the parasite. And normally humans, once it gets to the human, it goes into the nervous system and can cause serious problems in the brain and nervous system. And it dies in the human. It doesn't get passed on from human to human.
And of course, a big problem that those slugs and rats crawl everywhere, and they get on our foods. Dr. Martel, you've been seeing so many patients at this point. Talk a little bit more about what you've seen as far as how humans are infected and what happens.
Okay. I've actually known about this disease for more than 30 years, that I was introduced to it when I was in public health service out in Micronesia. That over the first 20 years or so of my experience with the disease, people were coming in with mild to moderate symptoms, bad headaches, mild nerve pain. They were getting steroid medicines, they were getting better, and they weren't suffering any serious long-term consequences. About 8 years ago, that changed on the Big Island, and I saw my first cluster of really severe cases. Patients who wound up in the intensive care unit, one who wound up in coma that was quite prolonged. And clearly something was changing with the nature of the disease that we really didn't have a good handle on. And that pattern of clusters of severe cases has continued up until this point.
You were just mentioning a few minutes ago before the show started that there were certain times of the year you were expecting to see more cases, but that may not necessarily be the case.
Right. So historically, we see outbreaks of rat lungworm disease during our rainy season. Okay, Hilo is always rainy, it's our rainier season, but generally November to February is when we saw the clusters of cases. This year was different, which is we saw some cases in the time we expected, but we had a dry spell, and then this latest outbreak of 9 cases happened over April and May, and that's just a complete change in the disease.
So let's talk a little bit more about the numbers. Dr. Jarvie, you've been very involved in the research and also tracking what's been happening with this. What was the first recorded case, as far as you're aware of, the species of rats, snails, slugs that are involved in this cycle? I would imagine they're not indigenous to the islands.
No, they're all introduced. So the first recorded cases date back to 1959 and 1960. Where there are 2 people that had they had passed in the hospital, and afterwards they did an autopsy and found the worms in the brain, or remnants of the worms in the brain in one instance. And we had a whole flurry of activity of really good researchers working in the 60s and 70s, and then the research pretty much died out for a couple of decades until we have this increase in the number of cases in 2005-ish or so, which I think not coincidentally parallels the introduction of the semi-slug to the Pahoa east side of Hawai'i Island to the Puna district. And that semi-slug has never been tracked as it should be. And now, in doing sporadic surveys, we find it all over the island, and more recently now on East Maui.
So Dr. Press, let's talk a little bit more about how this can be officially diagnosed. This is part of the problem. There are different discussions on how that should be approached, but for the time being, it's officially diagnosed by a spinal tap. So under those guidelines, how many cases so far have been confirmed, whether it be on Hawai'i Island, Maui, or the state in general? What do we know?
Yeah, so after that increase in numbers in 2004, the Department of Health brought the Centers for Disease Control out to Hawaii, and they looked at all of our case studies. And then we started working with them to try to find a diagnostic test for this disease, because up until then it was just based upon symptomatology. We became the first state in the nation in 2007 to make rat lungworm disease a reportable disease. So we have tracking since then, and in 2000, we were able to develop with the Centers for Disease Control, a test of the cerebral spinal fluid that can definitively diagnose rat lungworm disease, and that is the only way to definitely diagnose the disease.
So at this point, how many confirmed cases do we have?
So based upon, we started reporting in 2007, and in 2007 we had 2 cases, in 2008 we had 8 cases, and then 6, 9, 7, 1, 3, 6, and then in 2016 we had 7 cases, and 2016 we had 11 cases, and then as you said, this year we've already had 15 cases since January.
I would imagine some of the difficulty is the potential for misdiagnosis, as well as some people not going in and getting a spinal tap because maybe their insurance doesn't cover it, or fear, or so in that, if you follow that train of thinking, the potential for there to be possibly a lot more cases.
Yes, I mean, as with any disease, there's probably a spectrum of symptomatology, so there may be people that we don't get diagnosed, and you'd have to be pretty sick before you're going to agree to have a spinal tap, which is the only way that we can definitively diagnose it. So there probably are more cases than are actually reported in our database.
So Dr. Martel, as we mentioned, so closely involved with all the patients and what you're seeing and how this disease can affect people. It is, I would imagine, difficult for different reasons to get a real grasp on how many numbers we're dealing with here.
Yeah, it really is. And one of the big problems with this disease that we're seeing is that every patient presents differently. Some will come in with severe headaches, but I've seen severe cases without any headache at all. Some will come in with burning pain. Some will come in with minimal pain, but nerve weakness. So every case is different. Every presentation is different. And it's really hard to know right up front what you're dealing with. So it's not uncommon for these patients to come to the emergency room twice, 3 times before they get the spinal tap and the diagnosis is made. I'm sure some of those patients who get seen in the emergency department and don't get a diagnosis go home and they don't come back and the diagnosis is missed.
Now, unfortunately, there are some confirmed cases of deaths in this state. What do you know at this point?
That I know.
We've had 2 deaths.
Yeah, I know personally of 2.
2012 and 2015.
Okay, and I was not actually involved with either of those 2 patients, so I can't speak specifically.
Were those in the on Hawaii Island?
I believe so. I don't know for sure, but I suspect they were, because most of these cases were Hawaii Island.
So why is that, Dr. Darby? Why is the Puna District of Hawaii in particular, I think people are calling it essentially ground zero for rat lungworm. Why is that?
Well, we don't really know. We can hypothesize that since we see an increase in the number of cases with the introduction of the semi-slug, but again, any slug or a snail can be an intermediate host and a carrier of this. But it's just that this particular slug, the Parmarion martensi is the formal name of semi-slug. And it looks like it's the one with a little bump about the size of your pinky finger.
Yeah, we're talking about that. It's not necessarily at this point the most common,
right?
But it has some very distinctive look to it.
Right, right. It's got the hump on the back, and this is, I call it the super slug, because in terms of slug behavior, it is very, very mobile and fast. I've seen them crawl up walls, across hot pavement. They love to be in residential areas. So this particular slug, back in about 10 years ago, Rob Hollingsworth published a paper demonstrating that the level of infective slugs in semi-slugs was about 77%. In a comparative Cuban slug, which is a very different type of slug, it was only about 25% of those tested. I repeated that study more recently, and the numbers are coming about the same. So the semi-slug is remaining as a very efficient intermediate host of rat lungworm at about 70%. In our study, though, the Cuban slugs dropped down to less than 5% of those tested.
Let me get to a few of the viewer questions that we have here. And this is, I think, when people hear rat lungworm disease, for people who weren't as familiar with it, they think that it's a rat problem, which it is in part. So naturally, people would ask about the vector control program. This is Mark from Kona asking about that. Should we increase it? Will that help?
Yes. You know, we need to take a multi-pronged approach to this until we have a vaccine or some other way to prevent the disease. Certainly, if you can minimize the number of rats who are the definitive host for this parasite, and if you can reduce the number of slugs and snails that you have around your home and in the farms, then we can reduce the presence of this parasite in the environment.
So not at all surprising, people would be asking about how to treat their vegetables, what's enough. Grant is asking regarding prophylactic treatment of leafy raw vegetables. Have any studies been done regarding if food grade, say hydrogen peroxide maybe, or vinegar is effective? I think everybody's trying to try everything and they're not quite sure what is working, what helps.
Right, so we started working on this because we were immediately asked this question over and over again. So several years ago, we started a study looking at multiple solutions, hydrogen peroxide, vinegar, bleach, salt water. We know from the literature that bleach and salt water are effective. The problem with us with this trial was that we could look under the microscope and say that worm is not wiggling anymore. It looks like it's dead, but is it really dead? We don't know until you do the gold standard and put it back in a rat and see if it causes disease. That's very expensive. And so what we've been working on more recently is what we call a death assay, an assay that we can say that larva is dead, and we're using a differential staining technique to be able to do that. So we've got that assay up and running now. So we're poised to go back and really do these studies right, that we can actually say that larva is dead, therefore non-infective. But I must say, we did try vinegar and hydrogen peroxide, and those worms wiggled just as much after treatment.
And I think these are the types of questions and things that so many people are trying to do out there, including Laura, who, again, we're so glad you could join us and tell us your story. You are a nurse. You were careful. You followed all of the preventative measures. You were living in the Pune area, but you were aware of this based on the field you were in, and because people in the area were talking about this.
Yes.
And still, you contracted the disease.
Yes.
Tell me about what happened and what you experienced.
Well, I did take all the precautions. I was careful with my water supply. The water that was filtered down to a 1 micron level, and went through UV light, treated with chlorine, lots of different things like that. I was really careful, like I said, took all the precautions, washed all my fruits and vegetables, and I cooked a lot of stuff too, but I did eat out, and I don't know if that may have had something to do with it. I inspected, when I washed things, I washed them thoroughly and I inspected them.
So one day you noticed something different.
Yeah, I wasn't feeling well, and I had a headache, and I'd had it for about 10 days and went to the emergency room. Actually, it was about my 3rd time to the emergency room.
So it wasn't just any headache.
No, it was different than anything I'd ever had before. And when I went to the emergency room, they did a spinal tap and told me that, yes, I did have rat lung. And I was admitted, I think, 2 times for rat lung
So
disease.
what else was happening? You were experiencing other symptoms as well.
Yeah, I had kind of a tingling feeling that went up one leg, went across the abdomen and down the other leg. I had numbness in my right ear and pain in my head and neck. When I the follow-on care is a big deal too when you get out of the hospital.
You're talking about what happened when you went home.
Yeah, I think that's a huge problem. And my primary care doctor would not prescribe any pain medication. He felt like, he actually said that third world countries don't, they get through this without pain medication. But I had a really good friend, and my good friend talked to his doctor, and that doctor took over and was wonderful.
I mean, at this point, you were having some pretty severe symptoms.
Yeah, I honestly, it was the most excruciating pain I've ever been through. I was, it was worse than childbirth by far.
Where else were you feeling it? Because this is, as we've been talking about, a form of meningitis because of where the parasites travel, and how it gets into the nervous system, how it inflames parts of the body. You were explaining to me earlier tonight about the difficulty you were having with muscle control and because of the pain.
Right. Sometimes I could be walking and my legs would just give out from under me, or holding a glass and my hands would let go of the glass. There was shaking and chattering of the teeth.
And how long ago did this happen, first of all?
It actually started in mid-September with intense itching.
Okay.
And
over a year ago.
Oh yeah.
Yeah, not this past.
It's almost 2 years.
Okay. And it I think one of the areas that's not fully understood is the degree that it affects people, how long it's affecting people, how long it's in the body, what it's doing. You were having symptoms even after it was diagnosed for quite a while.
Oh yeah, jerking, just lots of different. Also, I had trouble with my bladder. Had difficulty urinating, and I would retain urine, and that would cause bladder infections. So there's a lot of different things that go with it that I don't think are always. I also had double vision for a month afterwards. After I was.
So a big part of it, you were saying, was when you were able to get the right kind of support and the right kind of help, but that wasn't always the case.
No, and like I said, I was so lucky to find the doctor that I found through a friend. And I think that more needs to be done to educate people, physicians, about the follow-on care after this disease.
Now, as we mentioned, you flew in from the mainland.
Yeah.
You used to live here in Hawaii?
I did. In fact, I had a small farm that was in Puna, and it was beautiful. And because I don't know how I got the disease, I had to sell that farm, and I've moved to the mainland.
I'm sure that was tough.
It was really tough.
Yeah. What was the most important thing for you coming here tonight that you want people to take away from your words and your experience?
Well, I would have to say that the narrative that this is a easily prevented disease is misleading, and I think it is kind of hurtful to those that have gotten the disease. It's misleading for what I said before, that I took precautions and I still got it. And I think it's hurtful because there's a stigma attached to it, and it makes you feel isolated and kind of left alone. And I think that a lot of times it's easy to blame people that are victims, saying, well, there's a reason why this happened, but I don't know the reason why I got it.
Yeah. And a big reason why we're all here tonight is to educate, to move forward, to continue this discussion. And of course, that's something that you want to see too.
Yeah, and I'm really thankful to Dr. Martell for taking care of me.
Speaking of your experience with some of the medical experience you had here, an important question that we have on our list, as well as one of the questions that our viewers called in, are doctors in Hawaii prepared to diagnose this disease? Is there special training that they need to properly identify the disease? Maybe to you, Dr.
Okay.
Martel.
I think the answer to that is really clear. I think that doctors are not prepared to make the diagnosis, and that education, particularly for physicians on the front line, the emergency room doctors and primary care doctors, really needs to be done, and it needs to be done in a comprehensive way. In Hilo, we have developed at the hospital our own education task force. We now have a pamphlet out for our ED docs, which explains the array of symptoms and how you use those symptoms to come up with a probable diagnosis and go ahead with the spinal tap. We're going to be pushing out a series of educational sessions to the community. But I think that basic education, here are the symptoms, here's how you make the diagnosis, here's how you judge the severity of the disease, here's the treatment you need to implement based on the severity of the disease, that just needs to be pushed out to all the frontline docs.
So here's another question from Rick and Puna, and maybe this is to you, Dr. Pressler. Has the state thought about restricting the shipment of potted plants, for example, between the islands? Might this confine the disease? Are there other types of restrictions like this that has even been talked about or considered?
Yeah, actually, the Department of Agriculture is working on that specifically. They have something called a hot wash that helps to eliminate slugs as well as other diseases in plants. I'm not an expert in that area, but the Department of Agriculture is
something
in
that's
fact
being
looking
discussed
specifically at that. And in fact, they received some money this year from the legislature to try to increase that.
Okay. So Rick was on the money there. That was one of the things they've been looking at. Here's something somebody else asked. This is June was asking this question. And this, again, goes to how much people don't know as far as what this disease is, what it can do. She's asking about, say, if the worm or the slug or whatnot is in some food and it gets cut or damaged in some shape or form. Will it still survive? Will it still live? What is the nature of this parasite?
The slug itself will die, but the larva will escape that slug and could live in a moist environment. And in our hands, in our lab, we've kept infective stage larvae alive for 56 days in water. And so, and also, asking why East Hawaii or now East Maui. That's one area of the state that's heavy catchment water use. Most people are on catchment. And, there were studies 50 years ago that demonstrated that rats can get infected from drinking contaminated water. So why can't humans? I think that's a real area that needs to be further investigated.
Yeah, you mentioned that filters, that's something also that you used, another precaution, but that still needs to be.
Yeah, we have a pilot study going right now. We've been able to test in collaboration with Hawaii Catchment Company. We've been able to test a couple of 20-micron filters, and we know that 20-micron filters don't block. They either go around or through those filters. And right now we're still trying to get additional funding to keep working on that study.
Dr. Martel, you, as you've been talking about, we're also Laura's physician. With each case, with each treatment, no doubt you learn a little bit more, see a little bit more, put more pieces together. What did you learn about treating Laura and some of the other cases that deviated from maybe what you originally expected with disease? What have you been learning as you've gone along?
I think that the primary lessons that we've been learning, and we've been working with the entire hospitalist team there so that they're working together with me on identifying these cases, is to be very careful in evaluating the patient and to determine how severe the case is going to be, and to identify the patients at risk for significant nerve damage and significant impairment and step in early with aggressive treatment.
As far as patients, maybe Dr. Pressler, this is a question for you from Aaron Wagner. The statistics that you have, do those include visitors that have experienced symptoms after they've been to the mainland? I think we heard about a case in California.
Yes, yes.
Those do include.
The only places where our lab here in Hawaii can diagnose the patients with the cerebrospinal fluid, as well as the Centers for Disease Control. We get notified if someone in another state who had been a visitor in Hawaii is diagnosed.
But again, they have to
with
recognize
disease.
the symptoms
That's correct.
and realize,
Yes.
which may be even a lower amount
Right.
of.
So our numbers include a couple of visitors. There aren't very many.
Okay.
Yeah.
So as far as percentage of, say, rat, lung, slug, snails, the hosts that are infected with this parasite, do we know at this point the percentage possibly? Have there been, is there any research in that area to get an idea?
Well, I think
how saturated?
As Dr. Jarvie mentioned, Dr. Robert Cowie has done surveys of the snails and slugs throughout the islands, and we know that that it's a statewide problem as far as the presence of the parasite in the snails everywhere in the state. The semi-slug, which does seem to be a bad actor, seems to be more prevalent on Hawaii Island and now recently in Maui. And as far as we know, it isn't present on Kauai yet. So
that we know of.
That's why.
But the parasite is, we're testing Kauai samples just now in the lab, and there's the parasite is definitely
Right.
there.
We know it's a statewide
So a
issue.
big part of the issue that you have is funding.
Mm-hmm.
You're aware of some of the areas you need to move forward. You're aware that there's not enough information to be able to get the kind of conclusions you know you need. What, aside from just getting the money to do the funding, what kind of research, when you do get the resources at this point, would you say is at the top of your priority list that we need to get to first?
Okay, well, let me just back up a step. And one study we just completed in January and February was related to our goals of developing a blood-based diagnostic, where we're working with CDC, and we were collecting adult rat lungworms from the hearts and lungs of rats. And so we captured 545 rats in conjunction with the USDA APHIS and the Hilo-based DOH vector control group. And over 90% of those rats were positive. That's an epidemic number. Going back to the slug itself, we know the semi-slug, we're talking about 70% of those tested are positive. That's a high, really high infection rate. We're running a trial for exposure to rat lungworm parasites in humans. And in that study that we partially completed, we're talking about 30% of the people have antibodies, meaning that they've been exposed, not that they have the disease right now, but they've been exposed to the parasite. So that's a fairly high number. In terms of the entire situation here, especially on Hawaii Island, where we have these numbers already, one of the main objectives would be to get a better handle on the levels around the state of not just slugs and snails, but of rats as well, infection status. And then you can target those areas more specifically with control measures.
So I'm going to try and squeeze in a couple of questions here. The ELSA test, am I saying that correctly? ELISA test, thank you. Developed over 20 years ago, is that correct? This is what Mike believed that's calling in at the UH Medical School. So is it a funding thing as to why this isn't being used more, why this isn't out there more?
It's basically a funding thing. And so our trials, our diagnostic trials to develop a blood-based diagnostic are based on what they're doing in Thailand. And Thailand has been working on this a lot longer than we have. And so they use an initial test, which is called an ELISA, and it's just for screening, because the test is inherent in the test are high false positive rates. But what we can do with that test is say, well, at least we think these are positive. And then we go in with a second test that's much more specific, using another antibody-based test, and then refine it.
My understanding, you're also testing a bait to deworm rats. Is that right? That's also another.
Well, that's on our to-do list, but
Okay.
I don't have the funding for that. You know, we're working on diagnostics. We'd like to work on finding ways to break the disease cycle, and so that's where we tried the vaccine that was developed in Spain, and unfortunately it didn't seem to work. We're proposing to try deworming rats. We deworm dogs and horses, and some countries, children. So why not try it in rats and see if it would be effective?
Speaking of trying to break the cycle, one thing that Dr. Martel, you're seeing is, and believe, is an increase in the severity of the cases that we're seeing out there. Why do you think that is? Why is that what you're seeing, and you believe that we're seeing an increase, and it will continue?
That I really do not think it's a coincidence that the clusters of severe cases started occurring after the introduction of the semi-slug. And Dr. Jarvie can speak to this maybe a little better than I can. For semi-slugs, it's not just that so many of them are infected with the larvae. It's the number of infective larvae that each semi-slug carries is significantly higher than in an African land snail or a Cuban slug. And you're seeing 1,000 or more copies of larvae in
Yeah,
semi-slugs?
we're seeing in some cases tens of thousands in a single slug. And so, you know, what is the infective dose to a human? We don't know. But if a slug has even 50,000 larvae in it, and the slime we know by testing, in our hands anyway, is maybe tenfold lower concentration of larvae than the slug itself. But even if you have 50,000, that's still a lot of could be a lot of larvae in the slime itself. So these semi-slugs are very efficient intermediate hosts.
So, Dr. Presley, so we're seeing, you know, an increase in the cases and very possibly an increase in the severity of the cases here. What is the Department of Health's position on prevention at this point?
So we want to take a statewide multi-pronged approach. We're working with the Department of Agriculture. We're working with the Department of Land and Natural Resources. We're working with the Hawai'i Invasive Species Council. We're working together with multiple areas in the University of Hawaii with research that they are doing. We want to put out a very comprehensive education and outreach effort to physicians as well as to the general population. Yes, we're putting together a plan. We need to do rat and slug control. We've got some creative things that might be an NIH type funded grant. We need federal dollars for this kind of thing that might be able to do a better job of controlling rats and slugs. And the last thing that we are working on with the Centers for Disease Control is to do a population epi study, which looks at sources of water, sources of food, and it's similar to what we did for the hepatitis A outbreak, where we were finally able to identify the source. We're going to need over 6,400 people to participate in this survey to have statistical significance, but it will help us finally try to get down back to where is this coming from? Where should we be focusing? Is it the catchment tanks? Is it something else? We don't know for sure.
Is this funding that was allocated, or is it now being shifted to deal with this?
We will be using the money that was allocated to us from the legislature this year for part of this, but we're also going to need to be using other funds and federal dollars because we've got $1 million over 2 years. It's $500,000 per year. So we're going to try to make that go as far as we can in a multi-pronged statewide approach to this disease.
That funding that you received from the legislature, that wasn't necessarily something you initially expected. And it's good to hear that a plan is moving forward. This is something that you were hoping for, that you've been working toward with the university for at least a couple of years now to get that type of funding. I know that's been a challenge. It's been frustrating.
Been a challenge, and it has been frustrating. This is our third year of trying to get funding from the state. Unfortunately, it sounds like the message from the state is they don't value research, at least at this point in time. And I think an education and outreach is incredibly important. You know, we've been working 5 or 6 years developing curriculum. We're the only ones in the world right now integrating rat lungworm STEM curriculum into the classroom, which is a very unique approach.
The rat lungworm working group, that's something that you're building. It's growing with volunteers and also with, I think you said, some small staff at this point in time. That is a huge focus for you and for some of the people in the area. What do you want to accomplish? What is the group working toward?
Well,
what's the priority?
The priority and
Are you talking about the governor's rat lungworm?
No, that's
group,
the
or
task
your own
force.
group?
Yeah,
Okay.
yeah. The priority for our Hawaii Island rat lungworm working group started with education because back prior to 2011, I had heard about rat lungworm disease, but looking at the DOH and the CDC websites saying it's mild, flu-like, self-resolving, I didn't really pay too much attention to it. And then I went to a meeting, which was at that time the second international rat lungworm meeting held in Honolulu. And I met Kay Howe and her son Graham. And Graham was severely infected in 2008, one of the worst cases. And I had never realized, because nobody ever told us, that it could be this severe. And so at that point in time, Kay and I started the Hawaii Island rat lungworm working group. She was a teacher herself before she had to quit her job to take care of her son. And since then, we've been a working group, and it's grown. A lot of the studies that we do, we could not do without volunteers because we never have enough funding to hire the people to do it. And so the Hawaii Island rat lungworm working group has evolved from just education now to helping with studies. And but education and outreach is a primary focus.
Let's get to some of these other questions. I want to make sure I get a few here. They're building up. Rose in Makakilo, she wants to know about slugs getting into the water supply, the parasites getting into the water supply. Fair question. How safe is the water from our taps? She's the average
Municipal water
Oh.
is safe.
Yeah, it's safe.
Yeah.
What about, this, and not surprising that we're getting a lot of questions from people asking about how do we clean these vegetables? What do we do? A lot of local farmers are concerned about that, and we're hearing that some of them are seeing the impacts of the concern of that being on the fresh vegetables that are out there. Such an important part of the industry.
So that's,
what can you tell people?
So that's why we're working with Department of Ag and with the Farmers Bureau and the Hawaii Invasive Species Council. So we are actively engaging, both working with the Farm Bureau and the Department of Ag, but also with groceries and supermarkets, so that if they identify, we're asking them to check their produce for slugs. If they find any, then our team goes out there and investigates, and then goes back to the Farm Bureau and to the farmers to educate them about protecting their produce from the presence of slugs and doing rat and slug control. So we're trying to get back to the farm, and then also when it gets to the grocery store, having it screened again and returned back to the farm if there is a problem, and making sure that the education is occurring at all of those levels.
So what about human-to-human contact? Say, for example, it was a couple having dinner, eating together, and maybe they exchanged utensils of some kind, other types of bodily fluids, whether it be needles. Can it transfer that way?
It's not transmitted between humans.
Not transmitted between humans. And what about, we do hear that it can be transferred to dogs and horses, I believe, but not cats as far as we know? I think that's what I heard last.
Yeah, I haven't heard any confirmed cases of cats at this point in time, but certainly dogs and horses, primates, zoo animals have died. There's a lot of other accidental hosts besides humans.
My understanding, as far as what else you can do with vegetables, for example, besides washing them as well as you can, what about steaming? Is it a particular temperature? Freezing?
Cooking for 3 to 5 minutes.
Cooking for 3 to 5 minutes?
Any parasites.
Will kill any
And
parasites.
freezing over at least 24 hours.
At
Well,
least
that
24 hours.
that
I think
we
I've heard
don't
two.
we don't know for sure. There was one study done in 2007.
1967.
Okay,
Avocado,
that showed
which
that.
is a very
Hasn't-
good study.
Okay, but
Okay, at least 24 hours.
we don't-
Not quite sure
we
yet.
can't.
Still jury out
I
on that
wouldn't
one.
tell everyone for sure
Jury's still out.
if you freeze that it's safe.
What about some of the, I think I definitely heard about some of the crustaceans or freshwater, I say shrimp, prawns,
Yes.
opihi, my
Right.
understanding also is something that can.
We don't have opihi, but we're talking about slugs, snails, freshwater prawns, frogs, crayfish, and crabs, freshwater.
Okay. I think we had talked about animals. As far as surfaces, say you put the produce down on a countertop, what is considered, as far as we know, good enough?
Bleach.
Using bleach, but not on the vegetables.
But
I
not
think
on
people
the
had asked about that. And we had talked about steaming. You know, I wanted to get to this question for you, Dr. Martel, because you're on the front line with patients, and you've worked with different types of treatments. We talked with you, Laura, about you had used steroids, you had used pain medication. Those are treatments. There's also a treatment that you use as well that's being used in some cases and that's still being discussed.
Okay. So the treatments that are considered standard is if patients have severe headaches, a spinal tap reduces the pressure and swelling around the brain, and the headache gets better. So periodic spinal taps every 3 to 5 days for severe headaches, that's a treatment that's out there. Steroids, anti-inflammatory steroids given in moderate to high doses appear to reduce the swelling and inflammation and reduces the duration and severity of headaches. The area that often comes up for discussion and sometimes somewhat heated discussion is the use of anti-worm medicines. And I think it's rather unfortunate that this is still an area of controversy because in Taiwan, China, Thailand, Australia, a combination of steroids and anti-worm medicines is being used frequently, very safely and effectively. And there are several papers out there, particularly from Thailand, that show that anti-worm medicines actually significantly decrease the duration of headache and the number of people who have prolonged symptoms. In the common discussion, there is the statement that worm medicines are discouraged because killing a bunch of the parasites simultaneously increases the inflammation because you get a lot of dead worms and you get an inflammatory response. In mice studies where they've looked at worm medicine, they've never shown that. In the studies of worm medicines in Thailand, Taiwan, China, if you look at the total number published, over 200 patients treated in the literature an anti-worm medicine, and there's never been a worsening.
So this still goes to the question of more discussion needed, more education needed, more research needed, which all of you are involved in. And an important question from a couple of people that called in about how we're educating our kids. And this is something that Dr. Jarvie, you've been very involved in, about teaching students about farm to table, best practices. And this is something you've been very much trying to incorporate because teaching kids about gardens, about what they put in their bodies, what are the potential risks out there, it is so critical to do.
And the Department of Health supports that entirely too. We think that's a very important initiative.
Kay Howe, who just finished her master's degree after bringing her son back to not normal health, but functional. She just graduated with her master's degree in December, and she started working with 5 schools on Hawaii Island with school garden projects. And the idea is to educate the keiki, and then the keiki will take that education home and educate their ohana and communities. And kids And we were able to produce a curriculum that was fun and interesting for kids. We incorporated the DOE science standards for second graders, so the teachers love it because it's a STEM curriculum, and it's really a win-win all the way around. Students are learning about slugs and snails. They're learning how to identify them, how to handle them and not handle them, and why it's important, how you can trap them. And you know, one of the schools was in Waimea, and from that one school they removed over 3,000 snails.
Wow.
Just in that one school.
You know, I wanted to make sure that I, you know, let Laura share a little bit more. I know it was wonderful for you to be here. We're so glad you're able to come down and share your experience. And it's important for us to make sure that people, you know, meet people and see people who have experienced this themselves. What do you want the people who maybe have questions, who are survivors of this, to know and take away at this point?
Well, I want there to be more information exchanged between people that, you know, are going through this. And I talked about the care following the hospitalization, how important that is to getting well. Like I forgot to mention that I did have 4 to 5 lumbar punctures total. And it was immediate relief. So, you know, I guess, you know, I'd like to have there be more known about it. It was really scary to not know what to expect, and, you know, I still wonder, am I ever going to feel the way I felt before I got the disease? But I am getting better, and I'm really thankful for that.
And I just wanted to make sure I let you know that we've been getting a lot of calls for people saying thank you for being here.
Oh.
You were a welcome voice, and they're so glad you were able to join us.
Oh, well, thank you for having me.
And I think we just have just a little bit of time left, and maybe I'm going to squeeze one more question here. This is from somebody calling in asking about what else people can do. Is there anything else they can do in their yards, possibly preventative measures? Any last words? If anybody wants to take this, I think we have one more question left out there.
Well, we would really like to see people take the incentive in their own yards to control rats and slugs, and you know, they can get slug control measures from home and garden shops. Just make sure they read the labels carefully about toxicity and protection of pets and children. Don't leave your children out in the yard unsupervised where they might be able to get a hold of slugs. More recently, we were saying don't drink out of a hose because slugs can be crawling into a hose. The water supply is perfectly safe, but don't drink out of a hose. And so some of those things.
Any other last thoughts?
And you know, for pets, people tend to leave their dog food out.
Right.
So that's great food for rats and great food for slugs. And so, you know, it's recommended to, you know, take the dog food in after the dogs have eaten.
And the rats love fruit, so not to have fruit lying around in your yard, and to clean up your yards.
That's a good point. Well, all of you are accessible and can be reached, and as we discussed earlier, this is something that we know we'll be discussing more. So thank you so much, all of you, for joining us. This is such an important discussion and something that more and more are on people's minds, and we welcome your expertise and your knowledge in these fields. So thank you, all of you, for being here. Thank you so much.
Thank
Glad I
you.
could be here.
Oh, mahalo to our viewers and streamers for their questions and for joining us tonight. By the response from the public on this topic of rat lungworm disease, as just mentioned, we've been told we will bring you a follow-up show in the near future. And again, we thank our guests, Dr. Virginia Pressler, Hawaii State Health Director, Dr. John Martell, Doctor of Internal Medicine, Dr. Susan Jarvie, Professor and researcher from Hilo Daniel K. Inouye College of Pharmacy, and Laura Travis. A very special thank you for sharing your experience. As we mentioned, there are a lot of people out there who still aren't quite sure to what degree that we're dealing with this disease, how it's impacting people, and to just get an idea as to the range of experiences that people are dealing with, I think is critical for everyone out there. So thank you again so much for being here. Well, Well, switching gears a little bit, another topic that is incredibly important to the public. Next week on Insights, we're going to explore the challenges faced by Honolulu's Emergency Medical Services branch. Important question, do we have enough active ambulance units and the EMT staff to service Oahu's nearly 1.5 million residents, visitors, and military? Important discussions coming up next week. I'm Laura Yamada for Insights on PBS Hawaii. Thank you so much, all of you, for joining us and for all of your questions. Ohui hou.